Hi, I'm Dr. Suvarchala. I'm the Scientific Director at Ziva Fertility Center. Often patients that come for infertility treatment are recommended for IVF, especially when all else fails, as in ovulation induction did not work, intrauterine insemination, also called as IUI, did not work, and there are quite a few factors which are glaring at them, which could be premature ovarian failure or advanced age or tubal blockages, severe endometriosis, PCOD which is very resistant, and all these procedures did not work for them. These patients we often recommend IVF for them. One of the major reasons they are skeptical and they are scared to get into this protocol is lack of awareness, which is why I wanted to talk about the procedure which is happening inside the lab. How are you led up to it? What is happening with you, and what are we doing with your eggs and sperms inside the lab? Basically, this procedure starts the second day of your cycle. Remember, second to third day is when everything is calming down inside your body, and if you were to give you injections, the ovaries respond well, and the eggs that were actually selected for next times periods and your ovulation will be growing. So with these injections we try to make them grow, and we are trying to pick a decent number, isn't it? When we're giving you so many injections and you're going through IVF, you want to make more embryos out of it. So we're looking at a good number, which could be 8 to 15, depending on your egg reserve, your age, the quality of your eggs, your hormonal levels, all these factors come into play. So on an average we're looking at that. When we do that for 10 days, we also call you for ultrasonography. We look at the growth of the eggs and we see if the hormones are of good dosages. Do we need to increase it? Do we need to decrease it? Is your endometrium growing as well? Is everything the way we want it to be? After about 10 days, we give you something called as human chorionic gonadotrophin. Now this is something which is already produced by the brain. What it does is basically triggers the egg to ovulate, that is, it is released from the ovary, comes and waits in the tube, and we are trying to mimic that as well in IVF. We give a larger dose because there's so eggs isn't sitting in the ovary, so we try to do that as well. We give you this injection, we call it the HCG, and in your terms, for you to understand easier, we call it the trigger injection. So it triggers the eggs to ovulate from the ovaries, but not yet, because we don't want them to ovulate. We are going to catch them just before they ovulate. So 36 hours later is when ovulation occurs, and around 34 to 35 hours after giving the injections, that's the window, 34 to 35 hours, we try to collect the eggs. Now what happens during that period is that we will be taking you into the operation theatre. We will anesthetize you for 15 minutes, and I said 15 minutes, so it's a very short procedure. A very thin needle is put into your ovary again, which means that it's not a surgery, it's not an open surgery. You don't require stitches, you don't require to stay back in the hospital. A very thin needle goes into each follicle, collects the eggs, and those eggs are passed into the lab, which is right adjacent to the OT, to the operation theatre. And once that is done, what happens to you is you recover from the anesthesia. You are made to lie down for about 3 to 4 hours, and you are asked to go home. Meanwhile, the story about your eggs and your sperms and the journey for your embryos begins in the embryology lab. What we do is, after about 2 to 3 hours after the egg collection, we mix your husband's sperm with your eggs. We could mix them together in a certain proportion. We have formulas for it. We could mix them, and when we do that, we call it IVF, in vitro fertilization, where the egg selects the sperm on its own, and the best quality sperm enters the egg. In ICSI, intracytoplasmic sperm injection, we hold the egg in a certain microscope. We hold each egg and put one sperm inside the egg. By doing so, we select the best looking sperm. We bypass the fear of not having fertilization. We also do this for people who have poor sperm quality. We also do this for previous fertilization failures, and so the idea is to have a larger fertilization rate embryos, have better more number of embryos, so that we are able to transfer a few and freeze few. So this is happening on the day the eggs are collected. We collect the eggs, mix them with your sperms. Next day we check for fertilization, and the next day, which is 48 hours later, which is day 2, we check if there are cells, proper cells, and there are a certain number of cells which need to be there inside the embryo on each day. It gives us the landmark, like a child has milestones to cross once it's born. embryos also have milestones. On day 1 they need to be fertilized, on day 2 they need to be 4 cells, on day 3 we need to have 8 cells. So we culture them in the embryology lab for about 3 to 5 days, and when we do that we select the best looking embryo. We transfer 1 or 2 based on your age back into your endometrium if everything is going well with the endometrium as well. If not, if there is a mismatch, if you think that the size is not good or the blood flow is not good, we freeze the embryos and transfer it in the next cycle or any subsequent cycle where the endometrium has improved. And when we freeze them, they are frozen in time. You need not worry. They're frozen in liquid nitrogen at minus 196 degrees with proper labeling, with proper barcoding. Only your embryos are frozen there, and there is no mismatch, there is no confusion, and you can come back anytime in future and have the embryos back again into your uterus. So this is in short what is happening inside the lab and inside the OT, inside the operation theatre on the day of egg collection. If you want to know more about this, if you want to know what medications we give you, what are the side effects, are there any side effects, please feel free to contact us. We will definitely get back in touch with you. Thank you.